Parkinson's disease. You've definitely heard the name, right? And for most of us, it probably brings one thing to mind, a tremor. But that's just scratching the surface. Today, we're going to play detective and go deep inside the brain to really understand what's going on with one of the world's most common neurological conditions.
So we're going to treat this whole thing like a medical mystery. We're going to follow the clues, starting with what you can see on the outside, and follow them all the way into the brain's inner workings. The big question we're trying to answer is, what is really causing these very specific changes in the body?
Okay, so where does any good investigation start? With the evidence, of course. And in the case of Parkinson's, that evidence begins with a very distinct set of physical clues, what doctors call the cardinal symptoms.
So here they are, the big four. First up is the tremor, and the key clue here is that it usually starts in one hand, at rest. Then you've got rigidity, which is this deep stiffness in the arms, legs, or even the torso. The third is bradykinesia. Yeah, it's a mouthful, but it simply means slowness of movement. And finally, postural instability, which makes balance a real challenge. See? These aren't just random things. They form a very clear pattern.
And this is so important to get. These symptoms are not just the normal aches and pains of getting older. No, this is a specific pattern, a set of clues that are all pointing to one thing. There's a much deeper issue happening inside the body's main control system. So, the question is, what is it? Let's dig deeper.
All right, we've seen the clues on the outside. Now, it's time to go inside, deep inside the brain, to what you might call the scene of the crime, to find out what's really going on.
To crack this case, you need to meet the main player, dopamine. Think of dopamine as the brain's text messaging system. It's constantly firing off these little chemical messages that say things like, okay, arm, time to move, or legs, let's walk across the room. It's absolutely essential for any kind of smooth, controlled movement.
Okay, this right here, this slide basically explains the entire mystery. On the left, you've got a healthy brain. The cells making dopamine are working great, the messages are flowing, and movement is easy. But now look at the right. In the Parkinson's brain, those cells that produce dopamine have started to die off. The messages get weak, they get garbled, or they just don't get sent at all. It's like having one bar of cell service all the time. That communication breakdown is what causes the tremors, the stiffness, and all the rest.
And get this, because this is just mind-blowing. Our brains are incredible at compensating for damage, but even they have a tipping point. By the time someone even notices that first small tremor in their hand, as much as 80% of those critical dopamine-making cells in that part of the brain could already be gone. The problem has been quietly building for years.
So you might be thinking this is all about movement, right? Tremors, stiffness, but you'd be wrong. This goes way deeper. The loss of dopamine creates a ripple effect, a cascade of problems that go far beyond what you can see on the outside.
And this is where the story gets even more complex. You see, because dopamine does more than just control movement, losing it can lead to things like depression, anxiety, and really serious sleep problems. It can even cause a loss of smell, sometimes years before a tremor ever shows up. This just proves that Parkinson's isn't just about movement. It's a systemic disease that affects the whole body and brain.
Okay, so we've got all these clues piling up. The motor symptoms, the non-motor ones. How on earth does a doctor piece it all together to actually make a diagnosis?
Now, this is probably going to surprise you, but there isn't a simple blood test or a brain scan that can just say, yep, it's Parkinson's. Not yet, anyway. The process is much more like good old-fashioned detective work, and it relies on a doctor's clinical expertise.
So a neurologist has to be a real investigator. They start with a deep dive into your medical history and do a full neurological exam, specifically looking for those big four motor symptoms we talked about. A huge part of the job is ruling out other conditions that can look a lot like Parkinson's. But you know what one of the biggest clues is? Seeing how a patient responds to medication that temporarily replaces dopamine. If the symptoms get dramatically better, well, that's a really strong confirmation.
Which brings us to the final piece of our puzzle. If the core problem is a loss of dopamine, then the goal of treatment becomes pretty clear. You have to find ways to restore that chemical balance in the brain.
And the approach isn't just one thing. It's a full-on, multi-pronged strategy. The foundation is usually medication, like levodopa, which is kind of like a Trojan horse. It gets into the brain and then converts into the dopamine that's missing. For some patients, there's a procedure called deep brain stimulation, which is kind of like a pacemaker for the brain, using electrical pulses to calm down the faulty signals. And critically, you have a whole team of therapists,
physical, occupational, and speech, who are essential for improving function and just maintaining a good quality of life.
And we have to be really clear about this next point. Right now, there is no cure for Parkinson's. So the entire goal of all these treatments is to manage the symptoms, to get that dopamine balance as close to normal as possible, and to give people the best quality of life for as long as possible.
But here's the thing. This story, this investigation, it is far from over. Every single day, scientists are uncovering new clues, trying to figure out what causes those brain cells to die in the first place. The hope is to one day not just treat Parkinson's, but to actually slow it down, or maybe even stop it before it ever really starts. And that leaves us with the big question: what will the next breakthrough be?